Good day, everyone. This is a very special event for the AMEE Patient Safety Special Interest Group. We do, if you're interested, meet every last Friday of a month, and please write to the emails as you see shown. The current chair is Robin Newton, Vice Chair Carice Knight, Secretary General Yannick Eller. Today, we have two lovely ladies with us that we're going to interview together with me and Dr. Bhuvana here. They have a great passion for patient safety. They're pursuing their PhD, and we're really excited to have them here to ask them a little bit more about what they're up to and how we can encourage others to do so as well. I am Sophia Ann. I'm the Vice Chair Medical Board for Clinical Governance and Medical Legal at the National University Health Systems in Singapore. I'm an anesthesiologist and also educator at the Yong Loo School of Medicine. With me is Dr. Bhuvana.
Hi, good evening, everyone. I'm a medical doctor by training. I'm a Deputy Director of National Institute of Clinical Quality, and I also head Medical Affairs, Clinical Governance, and Case Mix Office in National University Hospital. Very happy to be here and talk to you guys.
Fantastic. And now we have Dr. Sabrina Haroon. She's a senior consultant in nephrology at the National University Hospital. She's a medical director for both the in- and outpatient dialysis unit. She has completed a fellowship in high-risk dialysis at the Royal Free Hospital and holds a master's degree in applied science in patient safety and quality at the very prestigious Johns Hopkins. She has a great passion for patient safety, and she's been involved in many quality improvement projects. She had awarded a grant to launch Singapore's first national home dialysis program which was supported by the Ministry of Health, and currently she's pursuing a doctorate of health policy and management with a specialized focus on patient safety and quality at the Bloomberg School of Public Health at the Johns Hopkins University. The second interviewee here is Njoud Aldardei. She's a lecturer at the Medical Education Department of Fakeeh College of Medicine. She has an MBBS and a Master's in Health Professional Education at the University of Ottawa, Canada. And currently, she's pursuing a Ph.D. in School of Medicine, University of Dundee in UK. Her interest is in patient safety education, curricular development, innovative teaching, simulation, clinical education, and interprofessional education. Her experience is in curriculum review, assessment, faculty development, accreditation, and she has worked as a pathology resident in the Saudi board for 3 years. So a warm welcome to both of you. So I shall kick off a question to Sabrina first. What inspired you to pursue a master's and then a PhD in this field?
Well, I first started out day one as an associate consultant in nephrology, and then I was asked to write up an entire program of home hemodialysis, and I realized that was not really in part of my training as being a nephrologist. There were so many aspects, and in terms of home hemodialysis, I think one of the most worrying areas is obviously patient safety, and that's when I slowly have more and more interest. I took bite-sized courses, online courses, not really the full-blown masters right from the beginning. And then I fell in love with patient safety, and that's how I ended up with a master's and now doing a doctor of public health in patient safety.
That's so very inspirational and a great deal of effort put into it. We are very excited for you too. So how about Dr. Njoud? How about yourself?
Yes, hello everyone. Thank you for having us today. It's a great opportunity to really express and reflect on our journey. So what really inspired me is first, I've been always passionate really about education and academia. And I was really fortunate to have received a scholarship opportunity from my institution, Fakeeh College for Medical Sciences, to pursue a PhD in a highly well recognized and highly reputed university, which is University of Dundee, especially in medical education and in medicine. Whenever you say University of Dundee, the first thing comes to your mind is the pioneer of medical education is Professor Ronald Harden. So I feel really privileged to be a staff in Fakeeh College and then also a PhD student in University of Dundee. The reason why I chose patient safety, because I wanted my research topic to be really two-in-one, not only in education pure, but something that ultimately would have impact on the patients as well, even if it's an indirect way. So I chose patient safety education because I want to help graduate safe physician able to mitigate errors, identify errors, and having this kind of culture of safety as early as from their education. And so I was thinking what topic that I really want to spend the 3 or 4 years in my life searching about without being, I'm very curious, very passionate about patient safety. And I decided to do this patient safety education in undergraduate medical curriculum. The reason why I chose undergrad, because I reflect on my experience as well as being a medical student one day. So bringing my experience and starting with undergrad and then disseminating hopefully to other healthcare professionals. Thank you.
Fantastic.
Yeah. So it's really wonderful that both of you as clinicians, you all decided to pursue your post-graduation education training in patient safety. I would like to ask, like, now that you all have started on this journey, how do you all think learning this patient safety, how do you all think is going to impact your future medical education as educators? Also, like for Sabrina, like how do you bring this back to your clinical practice?
Yeah, so that's I think a very important question. I think I started teaching patient safety with Sophia and yourself to medical student, undergraduate students. And I think besides teaching just the concepts and principles of patient safety, I think what brings the impact and providing the examples is really, really very important. And having pursued masters was part of it. There was missing bits and pieces. The Doctor of Public Health in Health Policy Management actually completes it in a bigger picture. Now I'm learning things about strategic planning, health performance measures, even healthcare financing, things that actually helps me to provide a bigger picture to students that I'm actually teaching. And to my clinical practice, I think that fits all, because you can't just be doing patient safety and putting that aside. You do need to set parameters. You do need to write strategic planning on what you want to do for the program, and even plan the entire budgeting and look at how it performs.
Yeah.
That's wonderful that you can use it both for your clinical practice as well as your medical education. How about Dr. Njoud?
Yeah, so for me, my research is really have the third stage. So when I'm going to talk about my thesis in more details, but the third stage is mainly about outcomes of the research. I wanted my research to have an implication, really contribute to the field and have impact on the institution I'm working in nationally in Saudi Arabia and perhaps in the Middle East region in general, and globally as well. So based on the findings I have, like I've established some of the, themes that needs to work on, and all of them have an outcome of how can we, for example, faculty development, where you can find that lots of gap between the generation that for example, us, we graduated with really little attention to patient safety to those who are now we are teaching. So closing the gap and trying to filling the gap with initiating a master of healthcare of patient safety and quality improvement to empower the faculty. Other initiatives as like, for example, how to engage students more, what teaching strategies that really engage them, makes them very interested, make them also good for their memory retention. They recognize they can remember the information. And also we're working on designing, specialty integrated patient safety. So how each specialty can can implement patient safety education in their specialty, and not to teach it as a standalone topic, but how to integrate it within nephrology, for example, cardiology, and all other disciplines. So it gets really threaded into the curriculum, very settled, very well settled.
Oh,
Yeah, that's very inspiring, because you have to integrate the quality and the patient safety in the existing medical education curriculum. That will be more useful for our future students and professionals. Yes, Sophia.
yeah. So that means you actually believe in the decentralized style, because even the WHO curriculum on patient safety did mention you could do it centralized, you could do it decentralized. Are you more for doing both at the same time, or just have it really integrated? What were your thoughts? Yeah.
Well, actually, it's better to be like in standalone course, because there are some theoretical aspects of patient safety, and like, for example, Sabrina said, the risk assessment and system thinking and all of that has to be really taught in separately in a course. But how you integrate it into for example, in each of the disciplines and the subjects of medicine is also important. How you bring up the red flags, and you want the students to be aware of not doing so. This is common thing that flag things for the students. So it's better to be integrated, and as well in specialty integrated, as well as decentralized and decent. Yes.
Awesome. What are your thoughts about that, Sabrina?
Well, I think you need a bit of a both. I think working in a hospital, we do interprofessional teaching as well. So you do need a centralized when everybody is coming together, because when you do have errors and all that, we do need to communicate in a wider perspective. So we do need to have some centralized, but I agree with Dr. Njoud that we do need to decentralize some of that. Like if you're talking for myself, if you're talking about the renal unit, you do need to decentralize that part of it. So some centralized and some decentralized will make it perfect. And it really depends on the situation we are looking at.
And so I was also interested in how you decided to choose your particular master's, and what do you want to comment? Did you look around in the rest of the world? There are other master's or PhD programs, and how did you decide to choose the particular one? And could you tell me some pros and cons of other programs as you were going through? Sabrina, maybe you can start first. Yeah.
Yeah, so I chose Hopkins because I did the bite-sized courses with them first, and I was very impressed on how they look at patient safety. They use a more preemptive approach, and of course, they are one of the pioneers in patient safety, and that's how I really took up the masters with them. After completion of masters, I still felt that there was missing bits and pieces. That's when I started to look into more about patient safety and what else I could do. And there was then a difference between PhD and a Doctor of Public Health. I'm under Health Policy Management, Patient Safety and Quality track. I have to admit, I first had to Google what's the difference between the two. But Doctor of Public Health is really what a practical perspective of PhD. So PhD is more for the academia, and DrPH focuses on the practical aspects of things. So that's why we do a spectrum of coursework, all the way from data analysis, all the way to financing. And then after that, we do have practicum. Then it is then only we move on to dissertation phase. So I do these programs with a lot of other Doctor of Public Health students. We have a common coursework that we do, and then when we sub-specialize to health policy management, and then after quality and patient safety. And in the Doctor of Public Health, I meet some of them are like Director of Patient Safety in CDC, they are CEO, they are financial analysis. So I think it gives a really practical approach to things. And I wanted a broader perspective because myself being a clinician, I do not want to lose that focus of the clinical aspect. So besides being being affiliated with the university, I do want to have the practical perspective of things that I could still do, that I know how to look at, evaluate proposals better. I could still look at finance and budgeting. Yeah, so that's how I decided on a Doctor of Public Health.
Great. How about you, Dr. Njoud? How did you decide this one? I know you had a scholarship, but yeah,
So,
was there other thoughts? Did you compare with other programs?
yeah, so for me, actually, there were strategic partnership between my institution, Fakeeh College for Medical Sciences, and University of Dundee.
I
So
see.
they have already, frequent visits for curriculum review, for recommendations, and
Yeah, I
that we
see.
work on. So there was, because of this partnership, I was offered this scholarship. And what I really loved about this experience is that it's more of a blended learning PhD, where I don't have to be all the time in Dundee. I'm here with my
Fantastic.
family, but just having frequent visits, 2 or 3 times a year, depending on what I'm going to do. So gathering all of my objectives at one visit and doing different things while I'm in Dundee. So that was really a good point for me. And also because it is really a highly recognized university, especially in medical education. And there was flexibility on what you want to choose as a topic. Of course, it had, in education, but still I had the space to choose that I want patient safety. I want something that
Fantastic.
relevant to the patients as well and have impact on patients. And I've got really a great support from my supervisors, the institution also, and it was a great pick for pursuing this PhD.
You must both be pioneers, right? There couldn't be any other people that you know of in your department or facility that has doing PhD in patient safety for both of you, I imagine.
Yeah, yes.
Great.
I think Sophia and Bhuvana, I think you are both
Yeah.
pioneers in our institutions too, in patient
Yeah.
safety. Yeah.
We
We are on the job training.
yeah, not the job training.
Very, very humble.
Yeah. Dr. Bhavana, any next question?
Um, yeah, what I wanted to ask is like, yeah, I understood it's like, you both are very passionate about teaching and also passionate about patient safety. That's the reason you all chose this to pursue your PhD and your master's. But how has the experience been so far? Have you all faced any challenges? And has it been what you all expected, or is it like beyond your expectations? How has it been so far?
I certainly feel really I mean, I was overwhelmed by the amount of coursework, but it's absolutely amazing. I think I'm learning things and closing the bits and pieces that I don't really quite understand before that. So I think in the 1 year, I've actually grew so much that I've now start to look at things in a bigger picture. I learned how to write policies. I could critique program so much better than I did before. There are, of course, challenges because having to work as a clinician and I come back and I still have to do that. And the exams times are not revealed right from the beginning. So I could be having a finance exam over the weekend and then running the wards, doing it in the middle of the night. The Excels drive me nuts. And of course, I mean, this is distance learning with Hopkins. So there are occasional classes in the middle of the night, 2 a.m., 5 a.m., and all that. But I would say that my experience with Hopkins is really amazing and really good because I think with my supervisors, they take comments and feedback very well. We tell them we have difficulty with that. They will try to help us with things to make it possible for us. So I'm actually really loving this DrPH, and I can't wait to start again after the summer. Yeah.
How about you?
Yeah. So for me, actually, I had, yeah, of course, with every higher education, there is some of the challenges. So first of all, I'm a mother of two, and I have a teen daughter and a toddler son. So it's quite, sometimes I feel like I'm pulled at two directions and having to get that balance of being a mother, a wife, and also a PhD student and working lightly at the college as well. So that was a challenge. Another challenge is that to delve into, it used to be so difficult, like these research paradigms and theories that are very complicated, new terms, and trying to unpack these kind of ologies terms, ontology and epistemology, constructivist, and things like that. So it was very difficult at the beginning, but now I'm happy to say, like, as I'm 6 months away from finishing my PhD, these theories and research language
Wow.
has now been so lightly and, very, very comfortable to talk about. So that was a challenge that has been, with time, has been really resolved. And coming from a background of being a doctor of medicine, I'm used to, like, this is how you treat, this is how you diagnose, this is how you do. And it was my first time doing a qualitative research. I've never done it before. I don't know what is it. It felt like it's a huge beast at the beginning, and but with time, really, it's with reading, with support from my supervisors, it got much more clearer for me. One last challenge is that, although it was a challenge, but it turned out to be one of the best things. Part of my PhD data collection is to do semi-structured interviews with elite interviewees, such as leaders in AMEE and ACGME, executives in the School of Medicine, and, having to meet these people. And at the beginning, I was really, really unsure about my ability to do that, and I didn't have enough confidence to do it. I was so afraid, really, to talk to those, big names or something like that. And I was doubting myself whether I'm wasting their time. What if I'm, appearing silly? What if I don't understand what they said, or what? So I had lots of, doubts about myself. And once I made it, it felt so great. And I feel like I'm completely different person of how I broke this fear and have really this kind of conversations with great leaders. Fortunately, they were so supportive, very friendly, encouraged me even more to, they were like, please, yes, continue. What you're doing is important. Please go for it. And it has been one of the best things. And actually it made me start the building relationships and connections and get in the patient safety community globally.
Yeah, that's wonderful and very inspiring.
Yeah. So, Njoud, how long is this PhD been? You say you're finishing. It's how long is this course?
It's doing it as a full-time, so it's 3 years, and I'm 6 months away from finishing it.
Wow.
Wow.
I'm
How
now
about
in the right
Sabrina?
age.
Yours is because it's
Yeah.
part-time, right? So yours is longer, right? Is that correct,
Uh,
Sabrina?
Sabrina.
My DrPH is 4 to 9 years.
Yeah.
It has more components to it, I guess, because there's a practicum and a heavy coursework. I think most of our students are also almost working full time. So it really depends on how you put up you can go at your own pace and do it over 9 years.
Right.
I'm hoping to finish in 4 years.
That'll be awesome. Yes, yes. And very tough. I know you have kids too, and working and education and doing so many things. I really
Has,
admire. Yes.
yeah, has it been challenging, Sabrina, doing it online?
No, I was quite impressed because it started off with masters. That's why I was fully confident that they could actually get the DrPH done online entirely. Yeah, so that they have done it so long and so seamless that everything gets actually goes quite smoothly. Um, in fact, I think my friends had problems getting in with the visa and spaces going for the summer courses. I think there are more challenges traveling on.
I
Um,
imagine the US now, yes, with all
yeah,
that.
and I think the entire course can be actually fully online. So even presentation of the dissertation is fully
Wow,
online.
fantastic. Yeah. And would you like to tell us a little bit more about your thesis, Sabrina?
Well, I haven't gone to the dissertation phase yet. I'm still in the coursework phase, so in the planning, yeah, so to be shared later on, I guess.
Okay, all right.
Yeah.
How about you then, Dr. Njoud? A bit more
Yeah.
about your thesis, or if you feel
Yeah. Okay.
comfortable to
So,
share. Yeah.
so I'm adopting a philosophy that's called appreciative inquiry. So usually research is a deficit based, whereas the deficit, and that's where you do the research. But the appreciative inquiry, it's a philosophy that focuses on best practices. So what are your strength points and how you can make it better, even better. So I did, the first stage was doing a scoping review, and I've got this published in BMC. And I'm happy also I'm going to present it in Barcelona, AMEE 2025. The second stage was a case study of two case studies, actually in two different institutions. My institution, Fakeeh College, and the other one is University of Dundee. And I wasn't really trying to compare who's better or what is better, or because it's different contexts, completely different. For example, Fakeeh is a private college, and the University of Dundee is public and under the NHS. So this is why appreciative inquiry here is to explore what are the best practices in Dundee, what are the best practices in Fakeeh, and trying to look at the factors and how the context is different, the culture of faith is different. And it's like a sampling from different countries in the world. This is representing the weird. We have used the notion of weird and non-weird. If you know, it's an acronym. It stands for Western, educated, industrialized, rich, and democratic. And non-weird is the Middle Eastern region, Arabic and Africa, and all of that. So I've got the chance to sample each of these cultures and look at how it's differently implemented in different places, and how can we learn from each other. We replicate the best practices, share and adopt some of it, not to adopt exactly, but to adapt with our own context, and how this affects the curriculum, affects the staff, affects the students as well. And the third stage, which is the most important that we've talked about earlier, is the implication and the co-construction phase. Because appreciative inquiry argues that it's not a one-man show or I am coming to change the world. It is more of a teamwork, that everyone comes together and work together and start dreaming what you want to do better, and then how you make these dreams come true. So it's a co-construction phase, and that's where for example, the Master of Patient Safety that we have created, it's a teamwork from everyone, and you just initiate things and we work on it, in collaboration. And I have like other outcomes, but this third stage is, and I'm currently at this third stage, is to implement my outcomes, even if it's just an initiate, even if it's just a seed to plant. And also I'm doing my thesis writing at the moment for this last bit of the journey.
Yeah, feel free to have a Singapore appreciative inquiry. We are happy to participate in your extended PhD, or Sabrina could add on to this.
Yeah.
Yeah, it's really a great
Fantastic
approach. I
paper.
think
Fantastic.
it's
Yes, Dr.
because if you
Bhuvana.
keep it really gives energy that you are doing great. This is strength points here in Singapore. It's different. There's strength points in here and there. So it's good that you look at things from a positive aspect, which is great, I think. Yeah.
Yes. Agreed.
Yeah, that's wonderful. And yeah, we will be happy to be part of your study. So I was just wondering, like hearing you all tell about the program was like made me think of like how I came into this quality and safety. When I started, I was like totally new. I knew nothing about it. I just had a medical degree, then on the job, and then doing short courses, and that's how we learned these. But like having this kind of a structured program would be very helpful. So how do you all think our future medical students or even other health professional students, how should they be exposed to this patient safety education? Do you all think they also should pursue a master's or some kind of program for them? And if any of them are like passionate like you guys, what would be your suggestion for them?
I think I'm privileged at this point in time whereby there are masters available, DrPH and Ph.D and various courses available. I truly think you both and many seniors have actually built the foundation of patient safety now. And these courses are built now for people like us so that we could actually have it more in a more structured way. I think there's many perspective of patient safety you can learn. And all of these, you can bring it to patient safety education in a different way. So I feel that if for the younger generation, whoever who's passionate, they can always start with perhaps bite-sized courses and see what favors them and what interests them the most. Whether is it a clinical perspective, whether what are your target people that you're trying to teach patient safety education? Is it academia they're looking after? Is it the clinical professionals they're looking at? And then speak to people. I think there are so many people out there I've spoken to. It's amazing. I thought nobody would reply some of my emails. But everybody gave me some good advice. Everybody decided to answer my email and offered to speak to me when I asked for. So I'm very, very lucky. Yeah.
How about you, Dr. Njoud?
Yeah, so I think actually the good starting point that the world has really recognized the issue of that there is really less education in patient safety and how it's important to be integrated in curriculum, in postgraduate training, in licensing, in all of that. So I think it's important to start with setting up the competencies needed for patient safety, initiating the objectives of what you want to teach the student, what you think they should learn. And also the interprofessional education is really a great thing that should be also integrated. It's the scores of integrating interprofessional education is really low globally, and this is a recommendation by the WHO is to emphasize on that, because that's real practice. That's what we work on. We work with nurses, pharmacists, and all of the healthcare team. Another thing is that, as Sabrina has really mentioned a great point, is that when you communicate with others and you really get inspired by others who are willing, who are very passionate to share with you some of the insights, they want to speak with you. And the more you speak about it, the more ideas comes to you, the more recommendations that really it gets refined with other experiences. And so there's really, I think, within the near future, I hope there would be well-settled curriculum for all healthcare professionals, more interprofessional education, and patient safety competencies outlined from clearly for all the programs, and also more licensing, more the centers will be more, aware and prepared to train further, to train the trainees or the students as well.
Yeah, that will be great. We also, like when we conduct patient safety training, the assessment, the competency part is the one that we feel is a bit of a gap.
Yeah. Exactly. Yes. Mm-hmm.
Okay, so if you could have your no money is it's no limit, and yet all the resources in the world, what would your future of patient safety education curriculum you hope look like, Sabrina?
Well, I hope that there are more resources. I think there's time given for that as well. Because I think what happens is I feel that patient safety is not the priority for most undergraduate students, and even for training doctors is put aside. So I would like that there are resources be put into it, time, faculty, training into this, so that this becomes mandatory, this becomes compulsory, and probably as important as clinical everywhere.
How about you, Dr. Njoud?
Yeah, I think so for how I see this, it's patient safety education is really under, as Sabrina said, it's really not really being a lot of people undermined it. But I think that the way you teach it, the way you engage students, the way you, give them chances to, for example, think as leaders and start to think, for example, the quality improvement projects, how you give them a chance to think about things that you want it to be better. So they start to get the sense of it. And also it's important because if you just talk about theories, it might really put the students off. So how you engage them, how you make it interactive, it's all starts in the classroom. And also the educator skills is really important. How you, as educator, you facilitate the session, you make an interest, and you use different teaching strategies, different assessment methods, and you make it as relevant to the real practice and not to teach, have exams on it and just let it go. So it's more of what's happening in the practice. You bring in the classroom and start as interactive teaching. That's very important, I think. And more of interprofessional, I'm just again saying that how it's important really to integrate it into the faculties as well.
Dr. Bhuvana, would you like to answer?
Yeah, I was just wondering, like AI has kind of entered in all aspects of our life, right, including healthcare. So like in clinical practice, we have like robots, robotic surgeries, various like AI assisted, it can be used for like diagnosis. It helps the doctors to do their discharge summary and all kinds of documentation, AI assisted diagnostic things and all. So has the patient safety education caught up with this? So have they started thinking of like what could be the safety risks when we start using all this AI, and how do we then educate our younger generation in terms of patient safety when all this innovation and things come into place? Yeah, either of you can answer.
So I think we are all just so excited with AI, and people are jumping into grounds with AI. In terms of patient safety in certain areas, those that I'm familiar with, I do think that people have not looked deep enough and just apply AI. So for my DrPH course, one of the policy writing classes that we have, we are taught to use AI tools to specifically work on our long assignment about writing up a policy and the entire proposal. And then the purpose of that was to actually let us be aware of what the deficiencies AI actually have. And I feel that sometimes that this has not been evaluated good enough. Like for now, I just got I'm in one of the editorial board of the scientific journal. I've got an email to tell us that now we are starting to get submissions that are written by AI. So I mean, I don't think we have prepared ourselves enough for that. And as we introduce AI into our clinical practices and teaching in patient safety as well, we do need to have certain rules and policies to govern that as well. Like even students submitting patient safety assignments, whether is that allowed and even is that even appropriate for that particular course? I mean, otherwise, why even bother doing the assignment if it was for AI, right? Yeah.
Yeah. Yeah, I think for AI is really, it's starting to be very common for everyone to use, but really without caution is really, it might take you to the wrong direction. And in education, perhaps there is more like innovations in how you teaching like virtual reality and simulations and all of that, high fidelity simulation and all of that to teach patient safety or to teach in medical education in general, which is, I think it's great. But I don't think AI could replace maybe although there were some who argues that it can diagnose and it can that, but I don't think the critical thinking, the way as doctors think and diagnose and see the full picture and see the patient and touch the patient, really, don't think it can replace a doctor. And what happens if, for example, we rely on AI for its systems, for documentation, for all of that, and what if AI happens to shut off, for example, when at a certain point, everyone would be, so, it's going to be a big disaster. So just using AI with, caution and in the limited, capacity for assistance only, but I don't think it can, maybe in the future, I'm not sure, but for now, I'm still an old traditional and a fan of the traditional school of critical thinking and doctor being in charge for all the safety around and working in the environment.
Yeah, maybe our juniors might need to be told that use AI as an assistance rather than it cannot replace you. They should be able to understand the risks it comes with.
Great PhD thesis topic. I was so glad you asked that question, Bhuvana. I was just thinking also it's so relevant in this day and age. Anything else you'd like to bring out, Sabrina? This has been such a wonderful conversation.
Not really, but thank you for inviting me to speak and sharing my experiences. And I hope whoever is listening in will be inspired. And feel free to reach out to us and we can share more. We can share two different perspectives, PhD and a DrPH as well.
Great. How about you, Dr. Njoud? Anything else you'd like to add?
It's really thank you really for this opportunity, because we reflect on it and it gives us the chance of where we are, what we've learned, and see the journey from from a different angle, which is great. And thank you very much. And I'm very happy to answer any questions. And if anyone is interested in patient safety education or in education in general, I'm really willing and happy to make more of this and interact and communicate with people all over the world. And it's been really great chance to meet you all. Thank you.
How about Dr.
Thank
Bhuvana?
you.
Yes.
Yeah, thanks for this wonderful conversation, and I got to learn more about your master's and PhD program. Yeah, thanks.
Good. I shall just try to share just last time so that people who are interested to join us can just have a look at this. Yes. Just so that anybody else who's listening in and interested to join our patient safety special interest group, do feel free to approach us. And I hope everyone listening in had a good time and hope you'll join us one day.
Thank you.
So thank you, everyone.